Hello and welcome to our special show, Save a Life. Life is valuable and precious, and being able to revive a person's heart to save their life will provide one with immense satisfaction. It's a sad but a true fact that the number of people dying from cardiovascular diseases in India is steadily rising, and most of these cardiac deaths are sudden and on the spot. It is possible to prevent these sudden cardiac deaths if they receive immediate medical attention and CPR. The recent incidences of some celebrities collapsing suddenly and passing away due to a heart attack are concerning and shocking. And there is an alarming rise in the number of young patients with heart attacks and sudden cardiac arrest. What is equally scary is that sudden cardiac death may happen in people who have no known history of heart disease. The risk is higher for patients with existing heart diseases. In almost every family, we have at least one family member with a heart disease. Can one make himself or herself capable enough to save a life in an emergency situation? Yes, it is possible if you are well trained in CPR. Many adults in cardiac arrest can be revived with intact neurologic function if the bystanders provide immediate CPR. Raising public awareness and understanding of the practical applications of CPR is an essential strategy to increase the success rate of CPRs in cardiac arrest cases. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest, train them on CPR, and highlight the role of CPR in saving a life. Today, we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. Let me introduce our guest, Dr. Ankur Gupta, now joining us, who is an interventional cardiologist at Mediterranean Heart Center in Panchkula. We also have Dr. Dhananjay Kumar, who's the Managing Director and Chief Interventional Cardiologist at Jind Heart Hospital in Jind, Haryana. We also have Dr. Mandeep Garg, who's the Director of Interventional Cardiology, Mandeep Heart and Maternity Hospital in Sirsa. Thanks very much, doctors, for joining us. My first question to you, Dr. Gupta, what is atherosclerosis and what is the role of LDL cholesterol in the etiology of coronary artery atherosclerosis, and can it really be prevented?
Good afternoon, everyone. Atherosclerosis is considered the major causes of cardiovascular diseases. Atherosclerosis is the buildup of fats, cholesterol, and other substances in and on the artery walls. The plaque can cause arteries to narrow, blocking the blood flow to the heart. So excess LDL levels, it contributes to plaque buildup in the arteries. So we can prevent it by having a healthy heart life. That is to quit smoking, eating healthy food, and being physically active, right starting from the childhood and continuing it throughout the life to prevent atherosclerosis.
Right. Dr. Kumar, my next question to you. Many features of the environment have been found to exert an important influence on cardiovascular disease risk, its progression and the severity as well. What are those environmental factors which affect the prevalence of coronary artery atherosclerosis?
It is always said that it is the genetics who holds the gun, but the environment pulls the trigger. In the environmental factors, these are mainly smoking, tobacco, this all knows. But there are some other things just like air pollution, noise pollution, light at night, and the climate changes like heat extremes, direct storms, and the wildlife fires. Urbanization is associated with accumulation and intensification of these factors. The transportation noises, they activates the brain center, which in turn activates the stress hormones like cortisol and catecholamines. These causes the activation of the clotting system and then myocardial infarction, heart attack, heart failure, hypertension. The similar with the air pollution, which contains multiple things like nitric oxide, sulfur oxide, carbon monoxide, ozone, and matters. All these, they dysregulates the circadian rhythm of our body and they activates the thrombogenic capacity of the blood, and then the heart attack occurs.
Right. So those are very important points for all of us to keep in mind. Now, Dr. Garg, if I can come to you next, which age groups have the highest prevalence of coronary artery atherosclerosis, and can younger people get the coronary artery disease?
Basically, ma'am, this disease was basically old age disease in the previous era. It used to be considered to be the disease of old age of more than 60 in males and more than 65 in females. But these are all studies were of the old times. And in recent times, it has been recently seen that the coronary artery disease is becoming more and more prevalent in younger age, in around the age of 30, 35, 40. We routinely are getting patients who are having heart attacks around the age of 45, 50. All these parameters have now recently changed. Coronary artery disease is becoming more and more prevalent in younger and active population because of increasing changes in the lifestyle. Patients, people more and more having increased incidence of smoking and lack of physical activity. So the prevalence is more and more rising in younger population, and that too they are having more of related to sudden cardiac death. That is the most alarming thing which is happening in India.
Right. My next question to you, Dr. Gupta, what is the role of coronary angiography in the diagnosis and treatment of coronary artery atherosclerosis, and when is it really needed to perform this test?
See, coronary angiogram is the most accurate diagnostic test that's available for a range of heart problems. So, coronary angiogram is a test to find out if you have a blockage in the coronary artery. It's also used to diagnose a heart attack and evaluate blood flow in the heart. Patients who suspect to have coronary artery blockages or show symptoms of pain should be tested with coronary angiogram, and it is a pretty painless and a safe test that can be done.
Right. Dr. Kumar, if I can come to you next, who is the right candidate for angioplasty and who needs a bypass surgery? Could bypass surgery be a better option for some people?
This depends upon various factors like risk-benefit ratio, how acute is the disease. If the patient came to us with myocardial infarctions, means heart attack with ongoing chest pain, the BP is low, and the patient is in the heart failure condition, then in these cases, these patients should undergo angioplasty or stenting. If the patients have stable ischemic heart disease and with a multivessel disease, with left main stenosis is there, and the coronary anatomy is not good, like heavily calcified, heavily tortuous disease is there, and three or multiple stents are required. In these cases, the bypass surgery is better. Again, the prior disease association as is the patient having diabetes, any coagulation disorders, liver disease, cancer, kidney disorders, all these factors, they play important role in choosing who is good for PCI and stenting and who is good for bypass surgery. If the patients of stable ischemic heart disease, means the disease is not acute, it is present since many months or many years, and there is no sudden life-threatening, and the patient has diabetes with multiple vessel disease or the left main coronary artery disease, these patients do well with bypass surgery. In the patients who are not supposed to take blood thinners for longer duration, or because of some disorders blood thinners can't be given, these do better with bypass surgery.
Right. And if I can come to you, Dr. Garg, next, what are the signs and symptoms a patient should be aware of in post-angioplasty, and what to do in the case of an emergency?
Basically, the patients who have already undergone an angioplasty, they should be in regular contact with their doctor who is prescribing the medication. They should get regular tests, ECG, echo, TMT at regular 3 to 6 month intervals, so that each and every disease can be detected at early stage. They should stick to their medications as advised by the doctor. They should not discontinue. Generally, patients tend to say that I am well, I should not take medicines, and this is very wrong. You should take your medicines regularly. In case any problem of emergency arises, you should get an ECG, emergency ECG done, and you should consult to your doctor, and should take the medications as prescribed, and most important, you should not do a physical activity that causes angina. You should restrict your physical activity, and that activity should be prescribed by your treating doctor. And in case any emergency arises, you get an ECG done and get consultation from your treating doctor, and he will manage you accordingly.
Right, so very important advice there. We'll pause for a short break now, but we'll continue to address even more important questions after this very short break. Stay tuned. Welcome back to our special show. We take important questions now on cardiac arrest and the role of CPR as well. Dr. Gupta, if I can come to you on this question, what is the role of cardiac rehabilitation post-angioplasty or bypass surgery? Do home cardiac rehabilitation, is that really a possible option?
Yeah, see, cardiac rehabilitation, it is a secondary prevention strategy, and it has proven to be effective in preventing future cardiac events. Also, in better recovery, a faster recovery after the patient has undergone any cardiac procedure or any cardiac, like a heart attack or something. So, cardiac rehabilitation is recommended for people who have undergone any bypass surgery or angioplasty. Now, this cardiac rehab, it promotes faster and better recovery in these patients who have undergone angioplasty or any cardiac surgery in the first few weeks itself after the procedure. Now, cardiac rehabilitation, it is a medically supervised program. It is done in accordance with your doctor. It includes exercise, support, counseling, as well as education regarding what is to be eaten, your exercise program, your body weight, and regarding your medicines, how to take them from time to time basis. So also like cardiac rehabilitation or a home-based cardiac rehabilitation, it is a program that can be adopted independently by the patients or in conjunction with a facility-based program to which patients they lack access to. Thank you.
Right, and Dr. Kumar, the lack of CPR awareness is a big health challenge in India. Please tell our viewers about what are the main steps of CPR.
CPR are done in two steps. First is the preparation steps and then the CPR steps. First, check the scene for safety. Is the place where the person is lying down is safe or not? Is there any electrical wiring or fire or any road traffic? In this case, shift him to some other place and check for responsiveness. He's breathing or not, bleeding or any other life-threatening condition. Ask him, are you okay? Tap him and again ask, are you okay? If he not respond or not breathing, then just put him straight on his back on a firm place and then place both hands, heels on his chest by interlocking just like this, and then at the center of the chest, just below the nipple, press it around 100 per minute. The chest depression should be around 2 inches, and between each compression the chest should rise up to the prior level. Then give 2 breaths after lifting the chin and jaw lift and chin thrust. Then 1 breath is given for 1 second and the other breath for 1 second more. During each breath the chest should rise at least, and if it is not rising, then look for any obstruction in the mouth. If there is any loose vomitus or any loose food particle, then take out, and if it is not able to take out, then don't push it because it might go deep in the trachea. Then again repeat the cycle. If no help has come yet, call 112, and if the help has come, then give automatic electrical defibrillator shock, and if not, again do the CPR and try to shift the patient nearby hospital as early as possible.
Right, so that's very important, the process that you've now explained. And Dr. Garg, when should you stop doing CPR on a victim?
Basically, CPR is the process of reviving the heart, and uh, when the heart stops, the patient generally have ventricular tachycardia or ventricular fibrillation. It leads to brain hypoxia. Even absolute hypoxia of 3 minutes to the brain leads to hypoxic brain injury. And if it absolute hypoxia extends for more than 3 minutes to the tune of 3 to 10 minutes, and the patient's brain becomes permanently dead. So if the patient is having permanent hypoxia of 3 to 10 minutes, then it means his brain is already totally dead. You, by no method, you can't revive it. So, according to guidelines, you should not stop the heart for more than 3 minutes. So, best way is to, if you find any patient suffering from chest pain and he suddenly collapses in front of you at any public place, ideally we should have AED, automated external defibrillators. You should immediately give him shock, so that because heart rhythm goes out, uh, just like your train gets derailed, you have to make him the rhythm to sinus rhythm. You have to make the train come to that track properly. So either way, you have to shock him or you have to thump him. If the brain hypoxia extends about 10 minutes, then his brain is permanently dead. You can't revive him. And usually, after a CPR of 20 to 30 minutes, if the patient's pupils get dilated and he is not responding, we have to stop the CPR. And depending upon his organ donor, we have to find for some other options.
Right,
We
important
can't help
points
him
to
much. No.
Right, important points to note there. And Dr. Gupta, people often undergo surgical treatments such as angioplasty or coronary artery bypass surgery to remove the blockage from the blood vessel and to restore the blood flow to the heart. And they think that once the heart surgery is done, the problem gets resolved. But what's the real truth?
This is the biggest problem that we are facing. When a surgery has been done, like angioplasty or coronary artery bypass surgery, the patient or its family members, they will think that now the patient is completely fine and everything has been done. But this is not the truth. This is just a part of the entire treatment. Now the patient, after angioplasty or bypass surgery, the patient has to take care of many other things. Surely that angioplasty or bypass surgery will make the blood flow to be smooth throughout the heart or the arteries, but it will still not prohibit the buildup of the plaque in future. After your angioplasty or heart surgery, you should focus on eating a healthy diet and a healthy lifestyle to avoid over health risks such as high blood pressure, high cholesterol, diabetes, obesity, smoking. So these all need to be checked. Also, managing one's stress level is very, very important. Patients should be physically active in accordance with the guidelines that the doctor will give, that how much physical activity can be done from time to time. So if you are someone who is addicted to smoking, you need to quit it on an immediate basis. So these pointers are very important for a long and healthy life, even after undergoing a bypass or a cardiac stenting surgery.
Right, and we also read a lot about antioxidants, Dr. Kumar. How do these promote good heart health, and what are some of the foods that are the highest in antioxidants?
In our body, there are millions of processes occurring who turns the food into energy by using the oxygen, and their byproducts are the oxidative elements, free radicals. These free radicals, just like causing rust to the outer surface, in the inner surface of the body also, they damages our cell walls, protein metabolism, lipid metabolism, and they causes various diseases. Cardiovascular disease is one of them. The antioxidants are also, sometimes they are not able to take it. Then we give antioxidant from outside. These antioxidants scavenges the free radicals and save our immune system. There are various antioxidants like vitamin C, vitamin E, carotenes, selenium, and these are high in the green leafy vegetables, citrus fruits, mangoes, like papaya, tomato, seeds, nuts, and legumes, whole green vegetables, and whole wheat, etc.
Right, and in a developing country like India, Dr. Garg, anemia is very common. Is there a link between anemia and a heart failure?
Basically, in a developing country like India, prevalence of anemia is very high. So basically, anemia is a synonymous, as you say, if already your heart is weak and hemoglobin is less, your heart, it will cause more and more stress to the heart. Heart will have to function more. It will lead to precipitation of the symptoms. So it already various trials have proven that anemia and iron deficiency leads to precipitation of heart failure and increase in the symptoms. Basically, the patient will have more symptoms of dyspnea, chest pain, recurrent heart failure. So correction of anemia is very important. We have to give iron replacement to the patient depending upon his hemoglobin level, and we will have to even find out the cause of anemia. He may be having micro ulcers in his gut that may be leading to minor blood losses that may precipitate his symptoms. So basically, iron replacement is very vital to maintain the healthy heart for that patient.
And Dr. Gupta, what diet should a person follow after angioplasty or stenting?
After angioplasty, we call it a healthy heart diet. So more of the green leafy vegetables, nuts and seeds are important because they're also rich source of nutrition, antioxidants. So we have to also restrict the intake of saturated fats from our diet. So a healthy diet which is more rich in fiber is very important after any cardiac procedure.
And Dr. Kumar, overall, what diet should a person follow for a healthy lifestyle at large?
For a healthy life, a person should take more of the green vegetables, fruits, less salted diet, which are less in the fried foods, the pizza, burger type of foods and samosas. These kind of foods should not be taken. Mainly the vegetables, fruits, and whole grains, not the maida foods like. And we should do daily 30 to 40-minute exercise also.
Right. Thanks very much to all the doctors on our panel for answering these questions and really throwing light on certain very important issues related to cardiac health, cardiac arrest, and also CPR as a means of revival. Thanks very much for watching this show. Goodbye.